May is Mental Health Awareness Month. Hello everyone, I'm Joe Basicki. Glad to have with us Dr. Jay Case. He's Program Director of Virtua Behavioral Health. He's also Chair of the Department of Psychiatry at Virtua Memorial Hospital. It's great to have you here, Doc.
Thank you.
And this month has a lot of meaning to it, but first let's get to it right here at the heart of it. How prevalent are mental issues in our society today?
Mental illness is very prevalent, much more than people realize. Some studies say that somewhere between 18% of adults and 15% of children at any given time have a mental illness or substance abuse problem.
So obviously we want to help. It strikes home for all of us.
That's right. But despite its commonality, there's an enormous amount of stigma, embarrassment, and shame associated with mental illness, and people do not speak about it. And it's very under-recognized even by health professionals.
Well, hello to Mental Health Awareness Month, because you're trying to say what?
Right, exactly. And we think that part of the reason it's poorly understood and not talked about is that there's not enough understanding. And so our hope is that during Mental Health Awareness Month, we in the field can be providing more information and education to people, both about recognizing signs and symptoms of mental illness, and also to facilitate people talking about mental illness with each other. Because the ability to recognize things and talk about these things is the first steps towards healing and towards treatment.
What's happening at Virtua?
Well, this month in May, we're going to have a number of presentations all over Virtua. There'll be posters with education about anxiety, depression, and other common mental illness problems, in addition to which we'll have handouts and information about getting more education and where to seek treatment, as well as presentations to the staff to give information.
You're always the best dressed individual at Virtua. But now you absolutely come through in a big time color. Why?
Lime green is the color for Mental Health Awareness Month. And you may notice that I'm wearing this lime green ribbon. This is our Mental Health Awareness ribbon. We'll be handing these out to staff and encouraging them to wear them during the month, because this is a way to get people's awareness up and help them be discussing with mental health issues with each other.
I would imagine, Doc, you're hoping that the month of May can be so much about what you just said. But then the month of May is over.
That's right. And my wish would be that every month is Mental Health Awareness Month.
Okay, so to recap, what do you want people to know about at Virtua?
I want them to know that during the month of May there'll be information everywhere at all of our sites. That on the Vine there's going to be information coming in to seek more education, that we're going to be out there presenting, and that we're encouraging everyone to be talking with each other. And I want people to be able to talk about mental illness as comfortably as they talk about physical illness.
So a broken arm, you got a broken arm, you go to the doctor.
You've got a broken emotion, you go to the doctor.
And it's fixable?
It is fixable. Psychiatric illnesses, some of them are as fixable as a broken arm, some of them are as fixable as diabetes, but treatment and improvement are available for everyone.
Thanks for being with us, Doc.
Thank you.
He's Dr. Jay Case, Program Director of Virtua Behavioral Health, and he's also Chair of the Department of Psychiatry at Virtua Memorial Hospital. Thanks for watching.